The broadcast is now starting. All attendees are in listen-only mode.
Welcome to eGestalt's webinar titled HIPAA HITECH Compliance, Data Privacy and Security Best Practices for Medical Practitioners and Small Businesses. Today's presenters are Anupam Sahai, co-founder and president, eGestalt, and Kim Payne, VP of Sales, Western Region, Alert Boot Inc. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products, generating up to $350 million annually. Prior to eGestalt, Anupam was Vice President Marketing for Ixia Inc. He is a recognized expert in the areas of cloud computing, security, networking, and is a featured speaker at several industry conferences worldwide. Kim has 20 years experience in telecommunications records management and computer security supporting channel sales organization. He has been Vice President of the Western Region for the U.S. since 2009. He was involved in building sales platforms and partnerships that introduced these technologies to the marketplace and was integral in developing training and customer support programs to maximize adoption and customer acceptance of these leading technologies. If you have any questions, please send them via the question function in GoToWebinar, and we will address them at the end of the presentation. If you'd like a copy of the presentation, please send an email directly to Anupam or Kim. Their contact information will be given at the end. Thank you, Anupam and Kim, for presenting, and I'll turn the webinar over to you now.
Thank you, Mike. Welcome to the webinar. So the topics that we would cover today between myself and Kim, who's going to speak very shortly. We will start off by talking about the key HIPAA HITECH requirements for medical providers, which includes both covered entities and business associates, and we'll define some of these terms for people who may not be aware. Then we'll talk about the best practices and the implementation guidelines for privacy and security related issues as required by HIPAA HITECH for medical providers. And then we'll talk about some of the automated tools that come to the rescue that are available in the marketplace that can help you accomplish the HIPAA HITECH requirements. And then we'll also zoom into some of the data encryption tools that Kim will talk about, followed by concluding remarks. Before we start off the webinar, I want to put some standard disclaimers out there. Firstly, HIPAA HITECH is a constantly evolving area, and the requirements and the information here is subject to change. While we have made every effort to ensure that the information is presented is correct and up to date, we cannot offer such assurances. So if you have if you're looking for any definitive information on a particular topic, please do consult your legal counsel, auditors, or advisors. So where does HIPAA come from? HIPAA was actually enacted by Congress in 1996. It was also called the Kennedy-Kassebaum Bill under Clinton. HITECH was enacted in 2009. It was part of the American Recovery and Reinvestment Act. And both HIPAA and HITECH, the primary objectives of HIPAA and HITECH is to improve the quality of healthcare by providing portability of patient information, of medical information, medical records across different providers, thereby enabling reduction of cost of administration. So the cost reduction and the safeguards laid down by HIPAA HITECH is achieved by a combination of IT-related practices and non-IT related processes and practices that we'll talk about. Specifically in HITECH, as part of the American Recovery Act, there are specific incentives that are made available to medical providers to adopt electronic health records, EHR for short. And the incentives are provided by federal government to deploy electronic medical records that will in turn facilitate the portability and ease of sharing of information across different kinds of medical providers. But there are certain guidelines to prove what is called meaningful use. To ensure that the money is being spent correctly, medical providers have to demonstrate meaningful use of the electronic medical records before they get the grants, which in turn requires them to do risk assessment and follow HIPAA HITECH guidelines so that they can get the money. So with the HITECH Act, there were some significant changes done in how HIPAA and now HITECH is administered, and the scope of applicability for HIPAA HITECH was changed. One is that HITECH requires periodic audits to be done, and the audits can be done not just by the federal agencies but also by the state auditor generals. And the fines that are imposed, they've increased the fines that can be imposed, and the fines are returned to the administrative agency, to the enforcement agency. So they get a share of the proceeds that are fined to the medical providers. And if there are whistleblowers, or there's also a whistleblower clause in HITECH that provides provisions for sharing some of the enforcement penalties with the whistleblowers. So there's enforcement both from the top down, from the federal agencies and the state auditor generals, but there's also incentives given to whistleblowers internally in the organization, and for them to be able to report any misuse or potential breaches of information. There's also the breach notification requirement. As per HITECH, any data breach that affects more than 500 records need to be reported to HHS. And the scope of HITECH, HIPAA HITECH implementation now is not just confined to the covered entities, but business associates and their subcontractors are also within the scope of the law. So not only covered entities, but business associates and subcontractors, any entity that touches what is called protected health information. And I'll describe what the scope of PHI or protected health information is. Anybody who touches PHI is required by law to be HIPAA HITECH compliant. So the new penalty system that came into being as part of HITECH, clearly the fines have gone up. Earlier the fines were a few $1,000s, but now the highest tier of the fines can go up to $50,000 per violation, up to $1.5 million per year, and there are some criminal prosecutions that have been put in place also as part of HIPAA HITECH. So let me define some of the terms that I've been talking about. Covered entity is a medical provider that could be either a healthcare provider, a doctor, a clinic, psychologist, dentist, etc., or it could be a health plan provider, such as a health insurance company, HMOs, or it could be a healthcare clearinghouse. Anybody who deals with electronic or patient health information, protected health information, is a covered entity. Example of a business associate are entities that interact with covered entities, such as an attorney, a consultant, an accounting firm, it could be a hosting provider, etc., or a pharmacy. But anybody who deals with PHI, protected health information, needs to be compliant. So what is PHI? PHI, the definition of PHI was enlarged and the scope was broadened as part of HITECH Act. It includes patient's medical information, but also information about the patient that can recognize the individual. So it could be name, address, birth date, social security number, along with the medical history of the patient. So what are the specific requirements from the HIPAA HITECH perspective for protecting PHI? They fall into three different categories. One is a set of administrative procedures that ensure that the right policies, procedures, and the training is in place so that the organization who's handling PHI is capable of protecting the information. Then there are a set of physical safeguards that are recommended which ensure that the right people have access to the information on an as-needed basis. So there are physical safeguards such as electronic access entry cards and screen protection on computers so that only the required people are able to access the information and see the information with respect to PHI. And then there's a whole category of IT-related services, security services, which deal with how the information is accessed, how authentication happens with respect to people who are trying to access the information, how information is stored and transmitted across the network between different medical providers. And there are guidelines and processes and what are called controls, regulation controls imposed by HIPAA HITECH with respect to guiding how this should happen. So zooming in a little bit on the privacy requirements with respect to HIPAA HITECH, the new HIPAA HITECH rules expand the ability to have individual control, completely control who accesses information, how it gets shared with the person or beyond the person who's entitled to share this, and there are limitations on what kind of information can be shared with what kind of entity. It cannot be, nothing can be shared without exclusive permission from the customer. And certainly sale is not permitted without permission as well. From the security requirements point of view, data security point of view, we're talking about different requirements for securing data, whether the data is at rest, sitting in servers, backup devices, local workstations, or if the data is being accessed or transmitted over the internet, over the web, using email, using social media policies, using a remote VPN, or using a remote mobile phone. All kinds of access to PHI, protected health information, needs to be secured, and it needs to be done in a secure manner. So given the requirements, the question comes about as to, so how do we deal with all the requirements, and how do we ensure that as a small business, as a medical business, small or medium or large, how do I ensure that I'm following HIPAA HITECH guidelines as well as making sure at the end of the day I'm securing information that is critical to me as a business? So with respect to privacy guidelines, privacy implementation guidelines, PHI requirements essentially require that any kind of sharing of information needs to be documented and must be done with complete permission of the end customer. And what that means is seeking permission, ensuring the principle of what is called a limited data set. So what this means is that the patient information, PHI information, needs to be only shared, the minimum quantity needs to be shared with only the people who need to know. So ensuring the right people have access to the information that they need to know, ensuring who can see and use the personal health information, and the ability to segment the information becomes very critical. And segmentation is really partitioning up the information into small parts. So for example, the lab may not require all the medical history of the patient. They might just need to know what the patient name is, maybe the birth date, and that might be sufficient, for example. And then ensuring that the right person is getting access to the data through what is called multi-factor authentication, and I'll talk about that. And then ensuring as the data is being exchanged over the internet that the data is being transmitted in a secure fashion. Because surveys have shown that the ease of sharing and the ease of access of information is actually very convenient to patients. They want the information to be available from different portals across different providers, but we need to put best practices, and really at the end of the day, compliance or regulations are security best practices of the day that ensure safeguard of critical information. So with respect to security, I'll take you through some of the steps that are really best practices that medical businesses, medical providers, covered entities, and BAs, and all subcontractors who deal with PHI, deal with protecting PHI, typically do. The first thing is to do a dipstick survey, do a dipstick assessment of where do you stand with respect to compliance and risk gaps. And that can be done through a self-assessment. A self-assessment is really a set of questions that you answer to identify the gaps, the risk and compliance gaps, and then take steps to remediate those gaps to ensure that they're owners for certain best practices for as required by HIPAA HITECH. And in order to get electronic EMR grants from the federal government, and small businesses can get up to $44,000 from the federal government, larger hospitals can get up to $2 million for implementing electronic medical records. But before they can get the grants, they need to do a risk assessment and prove the efficacy of the deployment for EMRs through what is called meaningful use. And doing a self-assessment, risk assessment is a key requirement for demonstrating meaningful use. Second step, second key implementation best practice is to encrypt data. And Kim will talk about this in a lot more detail, so I won't spend too much time here. But the idea here is to protect and encrypt the data so that if an unauthorized person gets to the data, it's not of any value. It cannot be decoded and cannot be misused. Third step is to use BA agreements, business associate agreements, either with business associates or subcontractors. And the intention is to communicate and facilitate protection of patient information, of PHIs, so that potential misuse as the data is shipped outside of the covered entity to subcontractors, to business associates, that they are taking care of protecting the security of the data, the securing the data, putting together privacy and security best practices to ensure the data is not misused. And BAs could be labs, it could be shredding companies, shredding companies who collect garbage of physical PHI, patient information, and dispose it off in a secure manner. Anybody who touches protected health information, whether in electronic form or physical form, needs to be in the scope of having a BA agreement. Use of cloud and SaaS-based services, that's another big step that's being recommended. It's been found through multiple market research that not just for disaster recovery purposes, but also in terms of ensuring security of data, that cloud-based service providers have put in best practices already that small businesses, if they were to implement and store data in their local premises, may or may not be able to have that level of sophistication. So cloud-based services provide a level playing field even for small businesses who may not have IT services or IT staff to deal with all the best practices. So lots of medium to large businesses are moving in that direction as well. Multi-factor authentication is really a process of ensuring that the person who's requesting the information is indeed the person he or she claims to be. So while a username password is a single factor authentication, if you wish, where you're challenging the user with a username password, the two-factor authentication extends that one-stage authentication by adding another challenge request, whether it's in the form of a physical token or in the form of or ID card, biometric data, fingerprinting, etc. But there's two levels of authentication required. Maybe a shared secret code is another example of a two-factor authentication along with username password. So the idea is to challenge at least twice to ensure the person is indeed the person who he or she claims to be. Social media policy is a huge issue right now. Social media is very popular, and surveys have shown that people, even at work, use social media policies, and there were some breaches recently that were enforced wherein patient information was shared in a social chat room. So how do we prevent this? It's a combination of training, awareness, and then putting together a set of policies to safeguard trade secrets or patient information. Believe it or not, document sharing is an important step that one needs to secure. Again, as I said earlier, protecting PHI, whether in physical form or in electronic form, is a requirement. So if it's a garbage company, whether it's electronic backup devices that store patient information, dealing with how to dispose of backup information, trashed information, whether in electronic form or physical form, is important and needs to be monitored and enforced. And then dealing with unused tapes or backed up media is another example of how to secure PHI. Data leak protection tools is another form of protecting information from accidental disclosure, and a number of studies have shown that a lot of data theft happens because of internal threats, disgruntled employees potentially who might take away data or access data that they're not entitled to. So data leak protection is a technology which prevents copying of data from one device to the other without permission. And that's an important step to protect and secure your data. So the question is, how worried should we be? Are these threats of not only just enforcing HIPAA HITECH guidelines, but what if I don't do it? And there are lots of stories in the media about that security breaches, whether you're a small business or medium to large business, is actually quite real. Like in this case, there were, between August 2009 and December 2010, there were more than 6 billion records that were compromised. And this is of breaches involving more than 500 people. And smaller data breaches, which is less than 500 individuals, also are quite frequent. There were 9,000 small data breaches that took place in the first year of reporting. And penalties have gone up. I talked about HITECH upping the penalties for willful neglect, what is called willful neglect of not enforcing HIPAA HITECH. In other words, if an entity knows that they need to be compliant with HIPAA HITECH, which is pretty much anybody that touches PHI, protected health information, and they're not taking steps to remediate or fix issues, they can be liable for willful neglect, and they can be fined, or they can potentially be criminally prosecuted. HHS also maintains on its website what they call a wall of shame, which essentially is a list of breaches that affect 500 or more individuals. And you can go up to the URL and you can find the latest list of the breach reporters, and you can see here They include small entities, large entities, all kinds of entities, including covered entities and business associates. So this is not infrequent. This is something that is affecting a large section of the medical community, and steps need to be taken to enforce HIPAA HITECH, implement the best practices, and take advantage of the best guidelines, best practices. Now, some of the challenges that the industry faces today is that the solutions that are available today are very expensive, and they require a lot of manual work. And that's one of the reasons why I'm going to talk about Secure GRC and Alert Boot, which are automated tools that enable you to get HIPAA HITECH compliance accomplished pretty easily in a totally automated fashion. So what is Secure GRC? It's a cloud-based software as a service model, subscription model, that implements security and compliance management for small and medium businesses. The solution is scalable from very small entities all the way to large enterprises. And this is delivered through the channel, 100% focused on deliveries through the channel partners. There are two product versions. The low-end entry point for small businesses will be Secure GRC SB, which is focused on small to medium businesses who are looking for a self-assessment solution. And it's got everything built into the tool, which enables somebody who's not HIPAA HITECH savvy, somebody who's not PCI savvy, for people who are interested in PCI, they can walk through the questionnaire without having any prior expertise and take steps to remediate and deal with any open issues that come up. And I'll give you some examples of what and how that is accomplished. Then there's also a version of the tool called Secure GRC Enterprise, which is focused on not only your self-assessment, but it can also do audits and compliance management for the entire workflow. And the difference between the enterprise version is in terms of sophistication of the workflows and the configurability that's allowed, and the different models of compliance management. So it supports self-assessment along with auditing and complete customizability there. So zooming into Secure GRC SB, we've taken steps to demystify what HIPAA HITECH laws are, which can be pretty hard to read. So decoding HIPAA HITECH, mapping it to set of requirements that are applicable to businesses, whether you're a small business or a large business, the requirements and what needs to be done and what's applicable to you as a small business could be very different from a large business. So the tool does the mapping, does the demystification, and at the end of the day, the end user gets a set of questions that they need to answer in yes and no form. And all the information, the best practices, policies, and procedures that are required to answer the questions are built into the tool. So everything is out of the box available in the tool that our channel partners can help administer. I talked about EMR Meaningful Use earlier, which is essentially a set of requirements put out by the federal agency to do the EMR grants. So risk assessment can be accomplished by this tool to get the federal EMR grants. So a quick flavor, quick snapshot of what the tool does. So it's essentially a set of questions that get asked, and these are yes and no questions. So in this case, you are prompted with the regulation text, and then you're prompted with the question to ensure that you're following that. And included along with the question on the right-hand side, you'll see a set of policies and procedures, best practices, citation guidance, which gives you more elaborate details on what does the citation mean, because some of the legalese can be pretty hard to interpret and parse through. And then it gives you best practices to understand how to implement and customize the policies that you may or may not have, how to enforce that in the organization. So this is a screenshot showing you citation guidance, which talks about what does the particular regulation mean, and the best practices pertinent to this particular question is also available, so that you can look at the best practices, compare that with what's available or implemented today in your business, and be able to answer yes or no. And the channel partners are always available to answer any questions that you might have. Risk parameters is again a way to estimate the risk per citation, per question. And the tool has a built-in risk assessment module that allows you to understand where you stand with respect to the risk gaps and compliance gaps, how many questions you have answered so far, how many remain. So this is a real-time status update that you get on the dashboard of the tool, which enables you to understand your progress. And at the end of the day, you get, from the tool, generates an automated report on compliance with a summary of all the findings, which then can be used to plug the gaps, implement a set of remediation steps to implement plug any gaps that you might have to do the remediation. With that, I will hand this over to Kim to talk about Alert Boot and encryption tools that they offer. Kim, take it away, please.
Hi there. Hi, good morning and afternoon, depending on where you're at. My name is Kim Payne, and I'm with Alert Boot, and we're just going to go through, again, what we're doing. What we do is we are an endpoint protection product. What we do is we encrypt endpoint computers so that the data is protected at the endpoint. And very simply, companies and organizations today are being held accountable, and they're being held accountable by the HIPAA, which was is basically the framework, which under the American Recovery and Reinvestment Act, as Anupam was talking about. And HITECH, they basically have come up with the implementation standards for accelerating and adopting the electronic health records systems for healthcare providers. And they've also, under HITECH, they've increased the breaches, as Anupam was talking about as well. They've raised the maximum fine, willful neglect. They've also turned a lot of the power over to the state attorney generals so that they can actually prosecute HIPAA violations. And that goes along with the Office of Civil Rights and the AG. They can actually keep the fines to fund their own organization. There's new criminal liabilities and the new breach requirements, which Anupam was discussing. So the liability of burden has really been passed off now to all health providers, the business associates, and the contractors of those events. And the accountability issue is kind of an amazing event, because you've got Information Week was discussing in December of this last year that 16% of laptops would just go missing, that 5 or 10% are stolen within the first 5 and 10 years, and only 5% of those laptops are recovered. And you've seen some pretty significant data breach cases, one where a data breach case was recently settled with HealthNet for $375K, and they were fined in addition to that $250,000. And here, just this last year, we had 329 organizations lost more than 86,000 laptops. And this was according to the Ponemon Institute. And the result on that is the $2.1 billion worth of losses based on assets, information, etc. Inc. magazine reported in December that a laptop is stolen every 12 seconds. That's tremendous liability and tremendous amount of information that's just out there. One of the things you can do, just as the best practices, is you have to have a plan and implement policies and procedures on how do you handle a data breach. What happens, what are we going to do, what the function is. And it also deals with talking about securing equipment, life cycles of computer equipment, proof of destruction for computer hard drives, best practices of how to encrypt endpoint computers, and document that so that you can show it if you have a breach and you can prove that a computer was encrypted, then that provides safe harbor. Because what safe harbor means you can just prove it was encrypted. And that's all the judges and et cetera that are looking for. And then you need to have a very simple authentication for the users. They need to be able to access the information they need to do to perform their job function. And then you need to have single and multi-factor authentication so you can protect the endpoint computers from brute force attacks, those kind, but allow folks to go in and access the information or stop people from accessing information once they get in. The growing importance of encryption is phenomenal right now because most of the judgments that are happening in data breach cases are happening from the endpoint computers. And the safe harbor is, it's basically a get-out-of-jail-free card. Most of the data breaches that we're seeing are not happening through the internet, but they're happening because people are stealing their computers and laptops and the USB drives. And one of the things we've seen is our business has grown phenomenally, particularly in the European market, with the advent of what's been going on with the Fox News implementation of their data breaches. And so what's going on is encryption right now is becoming like antivirus and anti-malware, where it's one of the stabilities for what's working and what's protecting companies and organizations from data breach. What encryption does is very simply it converts data on your computer into a format that nobody else can read. And if somebody does break into it, what they end up with is basically a hard drive that's unreadable. One of the things is the detachable, the USB drives, making sure that those are protected. Also, any CDs that you have in your system. And what we're trying to do is just protect hackers from breaking into the Windows username and login to gain access, because there's known vulnerabilities known within the Windows system. And then even if you're logged into the system, we have some preventative measures that can stop people from gaining access to that data. One of the most important things that we deal with is how important passwords are. Passwords are extremely important. The longer the password, the better the protection. You need to be using large spaces, large characters, small characters, spaces, special characters. The more random and incomprehensible the password, the better the password is. It's also harder to memorize, so that's something to be thinking about with your users. And you need to be changing your passwords every 60 to 90 days. And make sure that you replace any temporary password on any device you own. And the main thing is don't use passwords, don't use usernames as passwords, don't put labels for your username and password on computers. You've got to protect yourselves from the quirky random runs on the keyboards, and also driver's license and social security number. That just sets up vulnerabilities for people stealing your identity and doing other aspects. Alert Boot, we've been a founder in this technology since 2007. We presently have over 20,000 endpoints that are protected. We have customers that range inside from 1 to over 10,000 users. And we've been proven as a third-party compliance authority with the protection of assets. We've got a Swiss investment bank that's been using our system now since 2007, so for 4 years. And they've been able to use the reports that we generate to go into the courts and prove the safe harbor aspect. Our CEO, Tim Malya, he has been named CRN's emerging vendor list. Again, the company was there, and then he's been also named as one of the managed services entrepreneurs. And what we do is we focus on endpoint data protection. And let me show you what we talk about now. We were talking about reports. What we do here, this is our report that's in our dashboard, and it comes up, and we can show automatically who the users are, what computers are protected, what systems are out there, and we can go in, and if need be, we can you can see the encrypted drive below. You can see the users. We allow multiple users per computer system so that you've got the authentication per user, and we can track that particular information. The reporting aspect is really one of our strengths, is we can go in And with our canned reports that we've got, also the programmability of these reports, lets you look at where your user's been, what they've been doing, those kind of things. We've noticed a 25% reduction in audit costs. From here you can see when the information was created, when it was last modified, when the last policy was updated, and we also do password policy protection on that as well. What we're really bringing here is a tested, proven technology. We're using AES 256. If you've been reading any of the things that have been going on with the WikiLeaks leaks, etc., the AES 256 is the state-of-the-art encryption bit that's going on. What we do is we manage, we test that. We're in partnership with Sophos on delivering this mechanism, and what we've done is come up with the mechanism for managing this from a central management point, and allows your client applications to be managed over TCP/IP. We have complete automated deployment tools. In fact, we have 3 ways that we can get people to deploy. We have a push technology that within an enterprise we can push that technology out. You can do it via email, send that information out. Or if you're users, you can allow them to come in and do a self-registration. And one thing we do is we remove the operating system away by doing what we call a power-on authentication. So when you turn it on, what you're actually getting is an authentication screen that's away from the operating system. Again, that stops the brute force attacks, etc. What we're able to do is simply provide proof of being compliant. And if you have any issues or questions or any help, we've got a support desk that can help users and people in dealing with any issue that arises out of that. Again, what we've got is a central-based architecture system so that we've got a central point for reporting all this information back and making it easy. We support Windows XP, Vista, and Windows 7 products, both 32 and 64-bit. And what we're doing is we can provide this through an enterprise-wide management system. And we can protect and enforce policies for your passwords. We can manage your user management. We can handle suspension, and also the USB encryption. What we've really been able to do is bring affordable enterprise endpoint encryption to all businesses. And here's our information. And let me go ahead and flip control of this back to Catapom. That's not going well.
Mike, can you transfer the control to me?
Sure. I can do that right now. I'll do that, Kim.
All right, do that, because I can't see control of that. Sorry about that,
There we
everyone.
go.
No problem. So just to summarize the webinar, last 1 or 2 slides to go, that it's important to understand how to get started with HIPAA HITECH implementation and to leverage the best practices. First thing to do is to assess the current status of HIPAA security and compliance, and then use technologies like Alert Boot to secure the data, and then assign owners to different issues that pertain to security and privacy related issues in the organization, and make sure it's implemented correctly. So in closing, Alert Boot, Kim talked about Alert Boot, which is an automated tool to ensure encryption of data to prevent misuse. Secure GRC SB is a tool for assessing and managing HIPAA HITECH security and compliance issues. And I want to say that compliance is an ongoing process. It's not a one-time event. It's a journey, and that needs to be, compliance-related issues needs to be looked at. The processes, policies, procedures, training, all that is an ongoing process that the organization needs to be ready to invest in, and ultimately it's going to result in not just becoming the business being compliant, but also implementing best practices to secure and prevent privacy breaches, security breaches of the data. If you would like us to help you understand what your situation is, feel free to reach out to Kim or myself for any further information about the solutions. We'll be happy to point you and get you more details. The contact information for Kim and myself is shown here. With that, I will open it up for any questions, Mike.
Great. Thank you, Anupam and Kim, for presenting. Like Anupam said, if you have any questions, go ahead and ask them in the questions area of GoToWebinar, and we'll get them answered. Okay, are you guys ready?
Okay.
Our first question. How difficult is it to install the encryption?
Oh, that's very simple. What we do is you can go on our website right now and you can sign up for the service. What we do is we send you down a custom URL. You can also do that from the end user point. And what we do is from that URL, we take over all the installation and the difficulties of installing the encryption, and it's in an automated process. So what actually gets done and what the user has to do is just answer a few security questions that's used in the recovery process in case they lock themselves out or something along those lines. And then we come in and self-install. You don't have to deinstall any software. We install over the top of the information that you have and then put in place the AES-256 encryption. Very simple, very non-intrusive for the users.
Okay, great. Thank you, Kim. Next question. What is the pricing?
You're welcome.
For which one? Is it for Secure GRC or Alert Boot?
For both. Why don't we give them for both?
Okay. Kim, you want to talk about Alert Boot pricing?
Sure. The Alert Boot pricing, we have retail pricing that starts at it's $12.95 a month per system. And we don't charge for users. We just charge for encrypting computers. So if you've got 10 users that are using multiple computers, we don't care about that. What we're interested in doing is protecting and providing the information on that one computer. No regards to how many users you have using that system.
And for Secure GRC SP, which is the entry-level product for self-assessment, that the retail price, MSRP price, is $750 a year. The enterprise version of the product, which is for medium to large businesses, that would be $7,500 per year. And depending on the number of regulations and number of users, the pricing could vary.
Great. Okay, we have a couple more questions, guys, but we're running out of time. So what I'm going to do is send you the questions, and you can respond via email to the person asking the question. And we're going to have a recording of this webinar up on eGestalt's website at www.egestalt.com. And if you have any questions for Anupam or Kim, their contact information is there. And you can email them or call them at any time. I wanted to thank the attendees for coming and Anupam and Kim for presenting. Thank you very much.
Thank you.
Hey, thank you.
Thank you for coming.